All right, everybody, welcome, welcome. We are ready to get rocking and rolling on this. Sorry about the few minutes late, but here we are. All right, I am Val Myers, and I am a holistic mental health counselor here in Bismarck, North Dakota. I actually specialize in children, but I am going to talk today about adult mental health, just because this has been a really popular question lately. Um, to know that when I talk about tonight, I'm a holistic therapist by trade, and I'm going to be talking about supplementation and things like that. And to know the FDA does not, uh, the statements have not in the presentation that have been evaluated by the FDA. We do not treat, cure, prevent any type of disease with it. As always, consult your medical provider. I am not your medical provider. I'm just going to teach you about some things that I do within the practice. And the statements that I'm making tonight are all educational in purpose. I am a mom. I am a CEO, and I'm the owner of the Kids Therapy Center. I also I'm a Nutrametrix provider, health professional. I'm a national speaker. I have also what I call the Kids Training Institute, but within that, I have a holistic mental health certification that I do with myself, Dr. Dwight Franklin, and Dr. Deidre Wells. So tonight I'll have some of that information in it. Tonight's presentation is a free presentation that I like to do. It does have some products that I use within my clinic. And we'll be giving you some information on that. So I'm going to go over the gist of when somebody comes to me, what are some of the things that I want you to be thinking of as we're looking at adult mental illness. So to know about 1 in 5 adults experience mental health challenges, anxiety and depression are the most. I think that anxiety is so common these days and depression. And what I'm really pleased about these days is we can talk about it more and more. Mental health is sometimes a very hard topic to talk about, but we are pleased that it's becoming less and less. I feel like it's starting to be okay that we're saying, I'm anxious, I'm worried, and talking about our feelings, right? So, but oftentimes when somebody is battling mental health issues, we start to think that there's something wrong with us or it's genetic and we can't change it. And this is just how I am. There's nothing else I can do or whatever. And even when I talk to somebody, it's not uncommon for them to feel like when I say, hey, let's look at some nutrition, they think that that's really far-fetched. And so then I just try to get them to try a little bit because maybe we can get some results with just that and they actually feel it. And to me, that's super fun. So, like, I work in the kid world a lot. This last 2 weeks, I had 4 or 5 defiant teenagers come to me. And one of them, the mom is like, okay, I will start what we call our daily essential packet. But as I was interviewing this family, I also said we should look at a food sensitivity dairy in particular. And they started the 3-day packets that I had. The mom called me at the clinic and is like, can it work this quickly? And I'm like, yeah, it can. Because if they're lacking nutrients or neurotransmitters are not fluctuating properly, you can see changes very quickly. And so that was a relief to me, a child that or a teen that has been numerously kicked out of school for whatever behaviors was now starting to regulate just because of some nutrition. But to know mental health impacts our sleep, our blood sugar, or it can be impacted by exercise, stress, gut health, inflammation, hormones, thyroid, genetics, toxins, and relationships or trauma. So there's a variety of things that can make our mental wellness feel different. Some of the things that I look as an overview is I look at nutrition. Do we have blood sugar issues? Is there food sensitivities? Is there sleep issues? Are they having a hard time falling asleep or staying asleep? Is there neurological stuff going on? Are they not detoxing or absorbing their nutrients that they have going on? Has there been trauma in their life? Is there mold? Do they have PANS or PANDAS, which is when you have like a strep infection and then you have the aftermath is mental health issues? Are they having a bowel movement daily? So these are all the things that I'm wondering in my head, what's going on, that we can help without medication regulate and have their mental wellness become better. So first, we always have to understand the basics of the body. It's really just kind of normal that I think people really don't know how the body works. So some of the first things I do is I teach everybody the stress meter, okay? That we used to have it that when you do the stress meter that like it's all your life or stress um that is hurting you, right? Or the events that are stressing you out. But it can be maybe it's part of your genetics that you don't handle stress well or you don't regulate certain things well. Maybe it's sleep issues that is off. Maybe it's food sensitivity issues. But in genetics, okay, we we know that they can behave these days. But so when I'm looking at the symptoms of the stress meter, I'm looking at if they have attention deficit or defiance, difficulty regulating their emotions, negative talk, low mood, sadness, whatever it is, that these are the symptoms, the overflow of the um the stress meter. And so from that, we need to help bring them down, right? So what are some of the things that we do help bring them down as we start to look at what could be going on? The first part of doing this, whatever we're looking at, is mindset. Sometimes I might have people that are quick to that didn't work, but there's actually, or I messed up and I didn't take it every day, or I didn't follow my meal plan like I should, or whatever it is. This is about good, better, best. And that when we start to do small things every day, we can start to make these big changes that can really impact our mental health. So the commonly one that we get, it runs in the family. Every time I even work with other counselors, it runs in the family. There's nothing we can do. They just really give them no hope, or like maybe we should do a med. And to know that I'm not against meds. I just think they have a time and a place for them. So epigenetics is something that we look at, and that is influenced by our lifestyle. Okay, so it's influenced by sleep, diet, stress, toxins, supplementation, and exercise. These are all things that we have control of to help change our epigenetics, right? We make them behave. They can behave low or high, dirty, not dirty, things like that. So some of the common things that we see in it is one called MTHFR. I bring this one up just so that people can understand kind of what I'm talking about. This mutation, 30 to 50% of the people carry this variation, and basically you don't absorb your B vitamins properly. It's not uncommon that when you feel sluggish and low energy and you hold on to toxins basically, and you need to detox those toxins away. But you need your B vitamins for your thoughts. You need your B vitamins for digestion. And so when you're consuming a B vitamin like folic acid that is synthetic, you might have difficulty that gene. Then you need something called methylfolate or methylcobalamin like that we carry within our isotonic product line. Within this, we also have something called COMT-AA, and this one we might see somebody has a low pain tolerance, right? So this is called our slow COMT gene. This one, they tend to have a harder time with stress. So they have the COMT-GG, the fast COMT gene. We might have a little bit more fasting. They can tolerate more. We can tolerate more stress, but we also are fast metabolizers, and we also might be more impulsive and have some ADHD symptoms. To know there is tons of genetics out there. And so I'm just telling you about a few, and basically one can also impact another one. So we don't want to go just get the MTHFR gene, because we know that if you have MTHFR and one of the COMT genes, it makes everything look very different. One of the other genes that I like to talk about is BDNF. And BDNF is sometimes known as maybe the naughty gene, and they might have some of the harder mental health stuff, but it also is the one that can be regulated by exercise. And so this one is not typically regulated by medication. It is the ones that we see that they kind of cycle through meds because they don't have all the things that are needed for that gene. But we know that we can test and we can look at a variety of them. And so why do we test? Because you can see a lot of the things that we're looking at, they can be aggression. So when somebody comes to me in my world, aggression's a big one that somebody comes to me for, or attention deficit, right? And and then with that, we want to be able to really help them. So I can play with some supplements with aggression. I also know gluten goes hand in hand with aggression. I also know red dye does. So there's things that I can do without testing, but testing can really, really help us break that down. One of the products that were one of the testings that we have at the Kids Therapy Center is called the Mind Map. In the Mind Map, we look at a genetic test called Strategy, and this can help us determine the type of lifestyle that somebody might need, right? So they might need certain vitamins to help certain feelings, okay? I look at this that I'm a worrier. I have a hard time getting out of bed in the morning. I'm not motivated, right? There's certain things that I have a hard time focusing. I might have some really big neuroinflammation that might look like I'm hearing and seeing things that aren't there. It might look like a diagnosis of schizophrenia or bipolar, but really it's neuroinflammation, and we want to bring that down. So we might use a mind map to look at that. But so the next thing that I would teach people is to monitor. Monitor a variety of things because a variety of things impact your mental health. We know that, right? So are you having a bowel movement every day? This is a huge thing that helps with our mental health. The gut-brain connection is what we call it. Our neurotransmitters actually start in our digestive tract, and then they go to the brain and back to the digestive tract. So our feelings and those neurotransmitters are not actually in your brain. They are, but they don't start there. They start in the gut, 90% of them. So whenever somebody comes to me and says, where do I start? Start pooping every day. Start getting in your vegetables. Start getting in that fiber. Fiber is huge for mental health. There's been some studies on fiber in teenage mental health and how much it decreases teen depression by just parents increasing their fiber intake, if it's through supplementation or through food. There's huge things that you can do by just healing the gut. So in the digestive tract, we have these things called villi, and they should look like the top where they're wiggly. And in there, the food actually gets absorbed at the bottom. So they kind of look like fingers. And they should wiggle down, break down your food, and actually then get absorbed at the base. Okay. A lot of food people have inflammation. If we have symptoms of things, we typically have inflammation. We might eat the American diet and we have inflammation. They look like the bottom ones. So sometimes when I just start with digestive enzymes or magnesium or ultimate aloe juice, it starts to bring that inflammation away. It helps break down things and they are able to absorb their nutrition. So it's not uncommon that when we just get the bowels moving, that we get better mental health. Isn't that awesome? It's so awesome to my parents say to me, the digestive enzymes are like our anti-anxiety or anti-depression type supplement just because they're getting the kids or their own bowel movements going. So what is a neurotransmitter? So a couple people probably know that ones are like serotonin. Serotonin is known to be our feel good, happy neurotransmitter. Okay. We see this low times with anxiety and depression. We see low energy levels. We see mood swings. We might see sleep changes or sleep pattern disruptions, hard time falling asleep, hard time staying asleep, things like that. There's a variety of things that can cause that, but that might be something that's low serotonin looks like. Low dopamine is that lack of motivation and that fatigue, right? Now think of all of our electronics these days that eat up the dopamine. So people will say to me, well, my kid can watch TV or they can play on their phone and they don't have any issues. But as soon as I take it away, they can't regulate. And it's because they ate up all their dopamine by that focusing. Something that's feeding your brain all the time with entertainment. It's easy to then use that dopamine to pay attention with that. So this is probably one of the most common ones that we have, but I don't want to just give supplements for low dopamine when it could actually be really high dopamine. And then we have similar symptoms too. So this is why we would test. We don't know if it's low dopamine or low serotonin. You can do a neurotransmitter test. You can play with some things, to know that if you get too much dopamine, it can look like aggression as well. So it can be low dopamine or high dopamine. And so you have to just be playing with this. You just got to be mindful of it if you're using supplements that increase dopamine or serotonin and whatnot. We also do test for this as well. We just don't test for it outside of, I'm in North Dakota and Dwight Franklin is in Florida. So those are the places that we would test for this. Sleep. Sleep is huge for your mental health. It's not uncommon that we're starting to see more and more sleep studies done on kids that have ADHD, because really they don't have ADHD. They're not sleeping properly. So with some of the things that we look for is, do you fall asleep and stay asleep appropriately? These are two very different things. Okay, so one of the tricks that I do a lot is I start with the basic vitamins or the basic low glycemic eating diet lifestyle, because with that, then I can start to get so our basic daily essential packet has B vitamins in it, which is a precursor to serotonin and melatonin. Okay, so they're getting their daily vitamins then, but it's increasing these other things. So it's not uncommon that when I just start with the basics, I get that. But also to know that because sleep increases some of these other things like anxiety, depression, aggression, usually defiance, that when somebody might use a product like melatonin, it will increase some of these other symptoms, so you might get vivid dreams. It's not uncommon that we see that melatonin increases defiance, right? So, and lots of times those kiddos are on melatonin, but we want to take those away. And we might give them other products, like I first start with magnesium or calcium, or we have a turn down product as well that I love. But in general, I might start with just daily nutrients, and then we move to see if they still have sleep issues. Typically a lot of people want to jump to a supplement. Supplements are easier to add because they don't want to change their food. But we know that when we eat whole food and we're eating low glycemic, we stabilize blood sugars. So one of the other things that we do as a holistic mental health counselor is that when we stabilize blood sugars, we stabilize moods. Okay, so low glycemic eating is low stabilizing sugar. So we might eat a protein and a fiber every few hours. We might make sure that they're getting enough protein in their day. As we age, we need more and more protein. We see lots of times those with attention deficit or high metabolism that they need more protein. So there's things like that that we do. But for the first step that we do is we just look at that they're eating whole food. How much sugar are they getting in a day, right? What is going on? And so it's helping stabilize these blood sugar crashes. I've been doing this now probably 13, 14 years. And some of the first things that I learned right away as a holistic counselor is that if we change our breakfasts to protein and fruit or protein and veggies, so eggs, meat, whatever, and get away from cereal or grains, that we have children or people who can focus longer in school. Their anxiety goes down because their blood sugar is stabilized. So it's really fun to see some of those changes within our kids. But what if something is impacting your mental health and you're not sure what it is, right? We know that if we eat a lot of garbage, we are going to get a lot of we might feel more depressed if we're eating McDonald's multiple times in a day or whatnot. We know that, right? We need nutrition. But there can also be something called food sensitivities. And this is when your body reacts in an immune way where it's like an allergy, but it's not, it's less. So you can go to the doctor, a medical doctor, and get an allergy test, but it might come back that it's normal. We can also look at something called a food sensitivity, and that is where your immune system still reacts to it some, and your intestinal lining has difficulty bringing it down. Okay. So we might see what we call a high food sensitivity quite a bit in that's causing inflammation, and the inflammation is causing mental health issues. So some of my top food sensitivities that I see and that research shows us is wheat, dairy, eggs, yeast, fish, nuts, and so forth. I will say in the clinic, wheat, dairy, and eggs are our biggest ones we see. Okay. Then there's tons of research around gluten sensitivity in the mental health world, and bringing down that neuroinflammation can help bring down some of those mental health issues. So we have some parenting memberships, which I'll talk at the end. We have a Calm the Storm class. And in the Calm the Storm class, we actually talk about, say you're having a hard time or your child's having a hard time, that during that time, I want you to eat whole food, meat, potatoes, fruits, veggies, real food. Okay. And then I want you to add into some supplements you can. I want you to meditate or take some relaxing time. And why is that? Because we know that if we quickly take out some of the things that can cause inflammation, we will bring our mental health symptoms back to bay. We know how hard the food can be. And so that's why we bring in supplementation. So I carry a couple lines at the clinic, but one of my favorite lines has been Isotonics, or by Market America, or Nutrametrix. I'm a Nutrametrix health professional, but the Isotonics line allows it to absorb like an isotonic state. Okay, so it helps us absorb those nutrients quickly. It is designed to when you drink it, it is designed to start absorbing. It doesn't need to then digest or go to your stomach and digest like your typical tablets and pills. Okay. What has been really fun with this line is I've played with a lot of lines. I've had patients use a lot of lines, and I always come back to this for a few reasons. One, I know how quickly it works. They work very quickly. I can help somebody that's battling severe depression, suicidal, defiance, because that's the one I get the most of probably. And I know that when they start taking these products, I can calm and regulate the body very quickly. And they don't have to go get an IV therapy then. They can use these products in conjunction with that, and they're much cheaper than IV therapy. So Isotonics has been a great line within our clinics because of how well it works. All right. Let's talk about where we start when it comes to products. We start with the gut. Some of my top products I like to use is Ultimate Aloe Juice. This is a juice, an aloe juice that has the alanine out of it. And that means then the laxative is out of it. So then it's safe to use for longer periods of time. If you do just get a whole leaf aloe juice from your health food store or whatever, to know that most of them have it in still, and then you can't be using it for longer periods of time. It also can taste yucky, and these taste really good. So this is super easy to drink. It's like your aloe leaf, except it heals the inside, right? And it heals your digestive tract. It's anti-inflammatory. It has over 200 nutrients, and it tastes good, right? So you can get it in strawberry, kiwi, cranberry, apple, natural. The other product that I'm using more and more is called Nutrametrix Prime Colostrum with Lion's Mane. Lion's Mane is great for cognitive health. There is tons of stuff out there for memory and focus and alertness. What I like about this, though, is also so many people have gut issues. And the colostrum helps with that gut, the function and the repair. I've had numerous people come to me now and say, after being on this product, one of them was only 1 month, one was 2 months. They now can eat some foods that they couldn't before. So it really helps the body in that healing process. Magnesium. Magnesium is very popular in the mental health field. There's tons of research around it that how it helps depression. But I think of B vitamin or magnesium is like the relaxing one. A lot of people take this at night. I like it for just relaxing the body. It's great for if somebody is needs to have bowel movements, you can up it and help it with that. But so those are types of things. I don't have B vitamins on here tonight, but B vitamins is the opposite. I like to use B vitamins for help regulating thoughts, right? Magnesium is help regulating the nervous system, the body, relaxing. Vitamin D. Another one of our first go-to products is vitamin D. I don't care if you live in North Dakota or Florida, most people are low in vitamin D. And vitamin D does so much for your body. It helps regulate hormones. It helps with mental health. So I see people that have low energy, low mood, and I give them or they start vitamin D, and that starts to change. Okay, it starts to get better. It also intertwines with a lot of hormones. Isotonics OPC3. This one I have been using more and more because of how well it does with neuroinflammation. You know, a lot of people think that when they think mental health, they think sometimes of, anxiety, depression. But when they hear bipolar, schizophrenia, neuroinflammation, hormones, PMDD type stuff, they think there's no hope. Now, I'm not saying that OPC3 would take away those symptoms, but it will decrease them because of the neuroinflammation. So pycnogenol is one of the main ingredients in here. Okay, so pycnogenol helps with mental focus, memory, cognitive function, brain fog. It helps with that oxidative stress. If you have trauma or just have a high stress life, you have oxidative stress, and this needs to bring it down. So basically, it helps open the inflammation up, helps get rid of inflammation so the brain has better pathways to help it. I have seen over and over again patients start isoton or the chew. There's a chew for OPC, and within a week and it starts that they start to notice that they can focus better. But OPC is not like a B vitamin where you feel it so quickly. It is a vitamin that when you use over time, it gets better and better and better because your inflammation goes down. But the pycnogenol that's in it has over 400 studies on how it helps our health. So that product is very important for us. Tonight I added in women's health. I have been using women's health more and more. This little packet is designed for women to have not just healthy complexions, bone, teeth, joints, all of those things. It also helps with something that we might call PMDD. And what it does is it helps support our estrogen and progesterone balance. It helps those mood swings and irritability, anxiety before the cycles that we see lots of times in women. The ingredients in here help directly influence serotonin, dopamine, and GABA. Okay, so I kind of made a list of how the women's health helps us. In the mental health field, it has become a thing that if a woman has a mood before her cycle, they are diagnosed bipolar. And I hope someday that goes away because that is not fair for something that's naturally going on with them that's not being regulated. So lots of times doctors are quick to diagnosing and saying you're bipolar, you need a medication. Right? They are felt that way. Something is wrong with me. But when you start to balance their hormones and you start to get the proper things in them, and if you're working with a doctor that does the Dutch test and actually evaluates hormones, it is pretty amazing what this can do. When you look at some of the things that like progesterone, when your progesterone dips, it looks like insomnia. So what does the bipolar disorder, one of the things is, have you had a manic episode, right? It can look like some of these things, but really your hormones are off. To also know some of the big things that women's hormones are off, I do have them try to eliminate grain and dairy, or pulling dairy can very much impact your hormones very quickly. Curcumin. People that have heard me speak before know that curcumin is one of my go-tos when it comes to depression. Our curcumin extreme has a product or a strain in it called curcu green. This is actually a whole curcuminoid. So when you get a curcumin or turmeric that has black pepper in it, they use black pepper for the transport and absorption of it. You will see that we don't have that in ours because we don't need it because we use the actual thing, curcu green. When you dive into the ingredients of curcu green and what the research is showing us, you will see that it takes down neuroinflammation, which is related to mood swings. It reduces the neuroinflammation, which can reduce depression and anxiety. It lowers oxidative stress. It supports serotonin and dopamine. It increases BDNF. So my naughty ones I was talking about, it can help regulate some of that. It helps regulate stress and cortisol. It supports the gut-brain connection because it detoxes you. So really, this product can improve mood, anxiety, and depression. To know women that if you have high estrogen, it's like a dim, it can clear it. But if you are having infertility issues and there's some of that going on, you might not want to be using this at the time. So always be talking to your medical provider of what might be great for you. When I'm just going to tell a quick story about curcumin. And, I get a lot of people who come to me because of suicidal thinking. I am a mental health counselor. And one of the things that we see over and over with this neuroinflammation that could be suicidal thinking, seeing and hearing people, is people don't understand neuroinflammation and how to bring it down. Now, suicidal thinking can come from a variety of things, but when it becomes something that could look like genetic or neuroinflammation and not trauma and so forth, it can be a combination of these things. I like to really focus on getting this neuroinflammation down. My go-to products are curcumin extreme and another product called Go Trim Core will boost serotonin by 28%. Serotonin, remember what it does? Now, to know we don't always want to boost it, but it is a great product when we do. And Go Trim Core also helps, it's a carbon inhibitor, so it also helps with weight management. But these products can really change somebody's life. I have used these products I had a young man who was institutionalized. And I helped him with these and then some diet change so that he could be not institutionalized anymore. And now today he actually finished high school. He drives a car and it's pretty fun when he stops in the clinic to say hi. All right. So our omega-3. Omega-3s, we know FDA says they can maintain healthy cholesterol, blood pressure, joint health. We know that they help skin, hair, and eyes. Omega-3s also helps there's research behind it of depression, right? So we know, again, that neuroinflammation, people that might have those mood swings, people that might have low depression, those types of things. It'll help with those types of things. The other thing that I like to use for omegas and OPC, by the way, is focusing and attention. It is pretty fun that when you get a therapeutic strain, and to know all of our products are in a therapeutic, almost all of our products are in a therapeutic dose. So if you just take our omega, it's a therapeutic dose. Where some companies, you need to really up your dose to get a therapeutic dose. Omegas are related to attention deficit. They can make them better, aggression, memory, cognitive functioning, and so forth. All right. So, what I'm trying to show everybody tonight is there is hope. So within the class tonight, I want you to think about what your next steps might be. So some of our next steps might be, do we want to purchase some products, right? We might just want to get some daily essentials or the women's health. We might want to get one of those and add in an aloe or some digestive enzymes, or we might want to add on a curcumin, a magnesium bliss, whatever it might be. Talked about a lot of products tonight. You might want to start the Go Trim class, and guess what? We have one going on Monday nights. It is via Zoom, so you can start anytime. We did an overview this last week on Monday. It is on the YouTube channel for the Kids Therapy Center. I'm happy to send it out to you as well. If you want to drop your email in the chat and ask for the Go Trim video, you sure can. To know that we will get you the product. The class is $300. Pam Torgerson, myself, and my daughter, Alexis Myers, who's a nutrition and behavior coach, are running the class. And it is a 6-week class. And we're learning how to eat low glycemic and whole foods within this class. I have some more upcoming workshops coming. You can see these classes that I have coming up on tkTCtraining.com to know that that website carries all of our trainings that we have coming up. If you are friends with me on Facebook, you will see those on there as well. If you're not, find me and I'm happy to be friends with you. So we have a variety of classes coming up. If you enjoyed this talk and you're like, hey, I want to go in more in depth with this, June 12th and 13th in Mandan, North Dakota, or virtually, we are doing our 2-day holistic mental health class. It does say bridging counseling and wellness, but to know this is the foundations class. We spend an hour talking about hormones. We spend an hour talking about genetics, an hour talking about neurotransmitters, an hour talking about movement, an hour talking about food, or no, it's a couple hours. One is on basic food and one is on therapeutic diets. So it's 2 long days. This one, last time we did it, it was 3 days. It is virtual this time or in person. To know that we are traveling with it across the US. It looks like we have Tampa, Charlotte, and probably Colorado Springs on our list within the next year, and Boston's in the next year. So to be watching for that as well. I talked a little bit about our parenting classes. We have a holistic parenting site called kidsneedwellness.com. On there, we have 2 parenting memberships, one called Calm the Storm, which is for parenting ADHD and ODD. And these are just kind of our big behaviors. You might not have those diagnoses. The foundations one is we really get into the therapeutics research on what food is known for what mental health issues. There are ways that you can get like more fiber in your kid's diet, right? Things like that. How it works is they're 1 hour a month, or if you can't join us live, you can watch the recording. Calm the Storm is actually presented by myself, Dwight Franklin, who's a Chinese medicine physician, and Kim Fredericks, my wellness coordinator. Foundations is done by myself and Hannah Wall, who is also a holistic mental health counselor and specializes in children and eating. So to know it's $20 a month. You can cancel at any time. You can also go to the website and pick up just the one workshop. If you want just one topic or whatever, you can buy them by themselves as well. Or you can go in, pay the $20, watch all the classes that are in there, cancel. Gives you a lot of information though. All right, so finally, if you would like to order products, please go back to the person that invited you to the workshop. If you don't have somebody that invited you and like to get some products, you can use this QR code, or go to the Kids Therapy Center website. Also, one thing that I don't usually do, and that's a 30-minute free wellness consult with me. With that, you are not obligated to buy any products. You can see that I have my calendar on there for the next month to get a consult with me. I am going to leave this up. I'm going to stop the recording and then I will answer questions. Okay, I need my Tyler to help me again, but I will put that other screen back up. I just want to hit stop recording. Thank you.